Professor Grasselli, what is the situation in Lombardy today?
Well, the situation is critical because we have a huge number of patients currently being treated in the ICU and in our hospitals. I know the situation of the ICUs very well since I am coordinating the network of COVID-19 ICUs. We now have around 600 patients being treated in the ICU in about 55 dedicated ICUs. And we have treated a total of more than 700 patients from the beginning of the epidemics. So if you think that in Lombardy, the total number of ICU beds was about 800, 850, something like that, before the crisis, you can understand that it's an incredible stress for the system.
What is the age range that you are dealing with?
The median age of the patients admitted to the ICU is 65 years. This means that half of the patients are older than 65 and half are younger than 65. In the last 7 days, we are seeing an increase in young people. So, for example, we had a patient, a 20-year-old boy, who was intubated 2 days ago.
What about children?
So, children, we have 3 or 4 neonates, I think, who tested positive and who have not so severe disease. And children, as in China, are basically spared, at least from the symptoms. I'm not sure that they're not infected, but apparently they don't get sick.
Now, given how incredibly pressured you are, do you have to, in a sense, choose between different patients as to who you can treat? In other words, do you, in the end, have to say, look, I'm sorry, if you're over 80, we really can't do anything?
No. Well, we are doing what we do exactly every day in our life as intensivists. So independent from the coronavirus outbreak, when an intensivist is called to evaluate a critical patient, he always has to make a decision about is this patient going to benefit from intensive care? And this is a complex decision that takes into account several factors, not only age, of course, but also, I would say, biological age. So comorbidities, other illnesses, past illnesses, current condition, health status, frailty, and so on. So this is something that we do every day, okay? Clearly, in this situation of incredible mismatch between the resources we have and the number of patients who we should allocate, we have to be more strict in this. I would not call it selection, I would say triage of the patients, but what is driving us always is the consideration that what we have to do is trying to grant to every patient who can benefit from ICU an ICU bed. And clearly not all the patients will benefit from an ICU bed, because if a patient very old or with a lot of past illnesses or with a very fragile condition at the beginning gets a bad pneumonia and needs a tube and a mechanical ventilator, his chances of surviving and of returning to an acceptable quality of life are very low.
Right.
Well, and this is a consideration that we do every day.
Yeah.
Clearly now it's more urgent because we have a huge amount of people in a very limited period of time. But at least now we have been able to grant ICU admission and intensive treatments to every patient who has been judged candidate to those treatments.
We have 377 patients and 6 dead. Now, do you see what we are doing as adequate, or do you look across and say, you should be doing what we're doing?
No, I don't think that we can compare the numbers because, as we've seen also in China, in the Wuhan region, they had a huge number of patients and a higher mortality than in the other regions outside Wuhan, where they had smaller epidemic episodes. So I think that what happened in Lombardy is just like a bomb that exploded, So the region has a very high density of population. All those people come and go from Milan every day. They are connected to every part of Europe. And so that's where the epidemic started. And then I think that, at least for now, surrounding countries are seeing, how can I call them, metastasis of this, but not the center of the disease. That's even in the surrounding regions in Italy, the number of patients and the number of critical patients are smaller than in Lombardy. And in Lombardy, we have, I'm sure you know, Lombardy is one of the richest region in Europe. So we have a very good health system, very modern, very efficient. So I don't think that the problem is that it exploded there, and before you can realize what's happening, you are like overwhelmed by the mass of patients. So hopefully in other countries it's not behaving like this. But what is very, very, very important for every country, and that's why the real reason why I'm doing this, is that everyone must understand that if you are not very careful in controlling the spread of the disease, this disease will overwhelm your system, no matter how efficient, good, modern it is. So the most important thing, besides creating new ICU beds, besides buying new ventilators, which is okay for people who are already sick, but the most important thing is to avoid a lot of people becoming sick. So you have to teach the population that they have to behave in some way in order to avoid the spread of the disease. I don't know. We are now putting in place a lot of severe measurements of containment, and that's the only way that we can try to deal with this incredible number of patients who are coming to our hospitals. And then the regional differences are difficult to explain. I don't know. I'm not an epidemiologist. I observe the numbers and the facts, and I see that in other countries they have smaller numbers, lower mortality. I have no explanation for that. We in Italy, the average age is quite high. So most of the people who died are patients above 80 years old. So patients who really cannot reasonably survive to a severe acute respiratory failure like this.
Actually, your explanation to us of the bomb that was in Lombardy, the ingredients were such that you got hit very, very badly. And those ingredients don't exactly exist necessarily anywhere else.
That's one explanation. And also, I mean, the bomb it's worse than a bomb, because, a bomb is one event limited in time and in space. This is an event that, keeps increasing, and it's contagious. Everything happens very quickly. If one had told me that in 2 weeks we would have created 500 new ICU beds or completely reorganized our hospital system, I would have said, okay, you are crazy. And it's happening now.
One more question, Professor Grasselli. Are your own doctors and nurses being infected?
We had a certain number of healthcare workers infected at the beginning, when everything was starting to happen. So now I think that they are using properly the personal protective equipment, and at least among anesthesiologists, the number of infected doctors is decreasing. But again, that's another big problem, because a certain number of healthcare workers are affected in those diseases, like SARS or those coronavirus diseases. So another important message for the population is that, and for the other healthcare system who are going to face this, is to train your healthcare workers on the use of on the proper use of PPE, because that's one of the most important things.
At this point in the development of this pandemic, is it possible, do you think, for Britain to suffer a bomb, as you put it? In other words, a sudden explosion of a real intensity of this outbreak?
Possible, it's possible. I think that you have the advantage of being late compared to us, so you're now realizing that this can happen, and it can happen in a rich and modern and well-organized region. Okay, so and I think that everyone, I'm being contacted by several people and several from all over the world who are asking us, what are you doing? How did you do it? And and this is a great advantage for you. So I hope that in other countries this is not going to happen, because they know that it can happen, and they have to get ready, to be prepared.
Professor Grasselli, thank you very, very much for talking to us, and good luck, and our thoughts are with you.
Okay, thank you.
Thank you.
Thanks.